Okay. Hi, everyone. Welcome back to another virtual shadowing session with dental shadowers. Today we have Dr. Dane with us. Thank you so much for joining, Doctor. We really appreciate your time. If anyone has any questions during the presentation, just please post them in the chat and we will get to them at the very end. So with that, Doctor, we are ready to begin whenever you're ready.
Okay. Thanks so much, Navia. Dental shadowers, thank you so much for having me. I hope this is somewhat useful for you. Pretty much just going to be talking about um, my biography, kind of putting myself into your shoes, probably where you are, maybe starting a little earlier, and then running through my education from undergrad all the way up through dental school, some continuing education once I graduated dental school, and then my life as a dentist for the last, let's see, about 7 years. So then I'll go through a couple cases and give you some tips and tricks, advice for those pre-dents out there, and then we can host all your questions that I may not have gotten to. So with that being said, I grew up in northern New Jersey, about 50 miles from Manhattan. And I have an older sister who's an attorney and a younger brother who's in IT, and they both still live in New Jersey, although not in our hometown. I always was pretty good in math and sciences throughout school, as well as somewhat artistic and sports I used to play. I was a big golfer, big skier. We had a little hill about 20 minutes from my house. I played roller hockey, and in high school, I also ran cross country. Starting with my education, I went to University of Richmond in Virginia. It was a small school, about 2,900 undergraduates. I was a classical studies major, which was kind of by accident. I started kind of as like a chemistry, maybe even a bio major, thinking I was going to do pre-med. And I ended up liking a lot of my classics courses that I took initially just to get some of those general education requirements out of the way. And at the end, when I graduated, it was me and one other guy who were the two classical studies majors of our entire class of about 800 people. So we had very small classes as I was getting higher up in those courses, but I really enjoyed it. And it kind of gave me a little break of doing the sciences, which I just felt like I got so much of. I was almost a chem major as well. I just couldn't present my research thesis because it conflicted with my classics major. But too many science courses and you can almost burn yourself out being in there and doing all those labs all the time. So if you're still kind of in the beginning of college, probably what I'd recommend is major in something that you like, something that you may actually get something out of when you're older or when you do become a dentist, because we do a lot of business, we do a lot of marketing, we do a lot of talking to people. So if you can psychology, if you can hone your skills in anything other than just being a total science like nerd, for lack of a better term, I would probably major in something that you're interested in. Believe me, you'll get plenty of the sciences when you're in dental school. So graduated college, always kind of still thought I was going to be pre-med. Didn't take the MCAT at the time, didn't take the DAT either, and I applied for a job at the National Cancer Institute in DC. So I went about 90 miles north, lived with a roommate who was also a college student with me. And for 2 years, I worked as a Cancer Research Training Award Fellow, which was a 2-year program. And it was kind of always the goal that from this program, it would catapult me into going to medical school. So I worked in the radiation oncology branch, kind of on two different type of projects. One of them was like looking at bioterrorism, and then another one was looking at specific drugs that could help people undergoing radiation treatment to either protect their normal cells or to kill more of the tumor cells. So ended up publishing a couple papers here. I really loved it. I basically wanted to be my boss because we had such a great relationship, and I ended up applying for MD PhD because I thought that this would be the best way for me to get into radiation oncology, and didn't get into any of those programs. So I decided I probably need to up my grades a little. And my grades were not bad at Richmond, but I kind of went from being a big fish in a little pond in high school to being small fish in a big pond in college. And I was surrounded by a lot of very intelligent people. So my grades, I still had over a 3.0 average, but they weren't competitive enough to get into, at the time, medical school. And probably even moving forward, I probably wouldn't have gotten into dental school either with them. So I moved back home to New Jersey, and I commuted about 40 miles to Newark and was considered a full-time graduate student. And I was just talking to Navia, and she's also in this program right now. Rutgers used to be called UMDNJ. And so that's the program I went into, the biomedical sciences. And essentially, this was just to boost my BCPM GPA. I'm sure you all know, but BCPM stands for biochemistry, physics, and math. So this is kind of the science GPA that the dental schools will be looking for. So you want to be competitive with this. And I think they want like a 3.3, 3.5. I'm not sure how that has changed, but I did not have that as an undergrad. So I decided that grad school would be good for this. And at this time, I was still planning on reapplying to medical school to PhD, the PhD track. I also decided that I wanted to get more than just a master's of biomedical sciences degree out of it. So I took a cardiology course and I really enjoyed it. And I approached my professor, and then I started working in his lab, and probably 10 weeks worth of research every single day, about 8 hours. I wrote a thesis. So I did actually get my MS degree as well. So that was kind of a big accomplishment. And I took some classes with both the medical school and the dental school. And while I was in grad school, a full-time grad student, most of my classes kind of were at night, except the time that I had to go in for my research. So during the day, I kind of went from having a full-time position 2 years after college to pretty much doing nothing. So I played a lot of golf, and my parents kind of put their foot down on it and said, you can't just do nothing and play golf. So it was actually a blessing in disguise, because through golf, I played with my orthodontist and my dentist. So they encouraged me to shadow them. And I had some pre-dental friends in grad school who also told me that I should just apply for dental school instead of medical school. So my parents made me get a job. So substitute teacher, I started doing that, still going to my classes at night. And that's when I had a little free time where, instead of playing golf with my dentist and orthodontist, I actually started shadowing them. So this is kind of where I discovered that dentistry was more than just a dentist walking in for 5 minutes and looking at your teeth, and that they actually did something other than that. So throughout these 2 years, again, I studied for the DAT. I shadowed orthodontics, some orthodontists. I shadowed some oral maxillofacial surgeons and some general dentists. And knowing that as a substitute teacher that I was probably going to be going to professional school, the headmaster at the school I was in knew that the whole application cycle took like an extra year. So that I would kind of have nothing to do for that year. And she hired me to become a teacher. So for about 1.5 years, I was a fifth, sixth, seventh, and eighth grade English teacher and a fourth grade math teacher. So it was kind of a rewarding time for me, but luckily I knew that I wasn't going to have to do that forever. So I've had a unique path. And I also applied to the UMDNJ's Gateway to Dentistry program, and I'm pretty sure they're still doing that. And I know UConn also has a program like this. If you're kind of unsure if you want to do dentistry, I'd probably recommend enrolling in some sort of program like this. They're very competitive, and it definitely gives you a foot in the door. So it is helpful. And it was just like a 2-week crash course into dentistry where we shadowed, kind of did little things like taking alginate impressions of our mouths and pouring them up. And we felt really important. So it was a nice program. And while I was a teacher, I I studied for the DAT. I took it. Luckily, it was a lot easier than the MCAT, so I did fairly well on it. And I was accepted to 3 schools, but my first choice was always UMD and J. And I was initially in on the wait list, and I was going to go to Buffalo, SUNY Buffalo, but then I got off the wait list very late and kind of switched out and decided that that's where I was going to go. So I began in August of 2012, and this is my white coat ceremony, which is kind of the swearing in and like your first 2 or 3 days of dental school. So I was those were my 2 roommates that I lived with that I kind of met online or probably through Facebook actually. And dental school was fun. I'm not gonna lie. We had a really good time. We did a lot of stuff. We went on ski trips together. We went up to Vermont a lot. We went to my friend's house who had a boat on a lake in upstate New York. We went to Placid. So we had a blast. I was, of course, the volunteer in oral surgery rotation to be the nitrous oxide candidate. So that's that picture in the upper left. On the lower left is, if anyone recognizes that photo, that's actually where Forrest Gump stopped running in the film. It's in Monument Valley, which is like right on the border of Utah, Arizona. And between our 3rd and 4th year, our school had a little mission trip where we went out and worked at the Indian Health Services. So we went, probably about 8 of us, and worked for about 1 week and did a lot of driving and touring through that part of the country. The Southwest is very beautiful. So I highly recommend anyone who hasn't been there to definitely put it on your bucket list. Couple cases that I did, actually, it's the same case in dental school. I guess I was pretty fortunate to do a lot of dentistry for my requirements and did much more than was required. So that was definitely helpful. And you kind of get out of it what you put into it. You can do a lot more than what is the bare minimum, what you need. And on the lower right there is a picture of me and my then girlfriend, who's now my wife. But I don't know if you all remember, there was at one point a news article where a dentist was out safari hunting and killed a lion. So that was our costume. And on the upper right here is me and my friend Mark. He's my best friend from dental school, skiing. So we were able to take a lot of vacations. He was also very smart, worked his butt off, and just finished his 6-year oral maxillofacial surgery residency last year. So he's down in Texas now. And then in the middle, I was actually the president of the Italian Dental Society. So we got some students together and went out to a lab in Staten Island. And I don't think my career would be where it is today without this man. This is Peter Pizzi, and he's a extremely talented ceramist, lab technician. And he came into our school to lecture as a guest lecturer for aesthetic dentistry in our 4th year, I believe, 3rd or 4th year, like as an elective. And I was just blown away by what he knew and what he did. And I went up to him and met him afterwards and went to his lab, and we started hosting these events with the Italian Dental Society. And the rest is kind of history. He's my primary lab technician right now for all of my aesthetic cases, and he and I have become very, very close friends. So he is definitely the reason I am where I am today. So I want to thank him for that. So yeah, we merged with Rutgers in 2014. I met my wife. She was a first year when I was a 3rd year. We met at a Halloween party, not the one that you saw in that photo. And I graduated in 2016. I guess I kind of always knew I didn't want to specialize, although prosthodontics kind of was always floating in the back of my head. But I just really wanted to be a restorative dentist, especially after hearing Peter's talks. I wanted to do kind of restorative dentistry with a focus on aesthetics because I saw how much it changed people's lives. So I knew I wanted to do a residency, and that's what I did. So I applied for only VA residencies, and I chose the one in Washington, DC. It was a 1-year program, and those are my co-residents. And I'm still close with actually a few of them, 3 or 4 of them. And we still see each other at meetings and things like that. So this was a very comprehensive program. We did literally a little of everything. So surgery, we did a lot of implants, a lot of um, crown lengthening surgeries, gum grafts, you name it, a lot of restorative, endo, which is root canals. Um, we did a lot of our own lab work, which I didn't mind because we did a lot of that in school as well. And we restored a ton of implants. And the thing that I probably got most out of it was we worked with oral surgeons, and we saw a lot of medically compromised patients. So we got very good with patient histories, and it was just very rewarding to be able to give back to the veterans who have kind of done the same for us. So I had an amazing year. I couldn't recommend doing a residency enough. In New York State, which is where a lot of my classmates were from, you can't work in private practice until you do a residency. It's kind of a requirement. In New Jersey, it's not the case, but if people didn't specialize in our class, or if they weren't international students already from different countries, I would say 95% of people did a residency. They're just very invaluable. So you think you know a lot after you graduate dental school, but it's just the beginning. You really don't know much, if anything. So yeah, that's a perfect segue into continuing education. So that's kind of like what I just said. Even after a residency, a dental degree is just the beginning of your journey. It's a license to do bare bones dentistry. You know, the 2 crowns that some schools, or 5 crowns, let's say, that some schools make you do, is what sometimes you can do in a day in practice. Or some schools make you do 20 crowns, which was the case with us. So every school is going to be a little different. And you really don't have, you're not as good as you think you are. So your first 1 year, especially, you're going to learn a lot. So Peter was kind of my motivating factor to go to Coy Center, which is out in Seattle, Washington, and it's a comprehensive dentistry center where you kind of learn how to treatment plan, and you learn about the bite, and it's a very comprehensive program. Takes about 7 weeks to do, and you learn from this incredible man named John Coyce, who's one of the best dentists in the world as an educator, and people from all over the world come to see him. So he got me hooked up with him. He also told me I need to buy a camera, and I think photography is definitely now a passion of mine. It was of Peter's, and he has gotten me into it, and I have 3 cameras now and probably 6 or 7 different light setups. So I do a lot of photography, and that has grown my dentistry and really trained my eyes. Um, American Academy of Cosmetic Dentistry, also another association that I'm involved in, and right now working towards getting accredited in the AACD. So that has also been like a monumental impact on my eyes for dentistry, my photography, and my skills as well. And then the AGD is just a great organization, kind of like the competitor of the ADA, which you can track your continuing education hours through and things like that. And I am a fellow. I got it a couple years ago, and that's getting 500 hours of continuing education, as well as passing a test. And just to let you know, I think you only need 20 hours a year. So this would be well over what I needed. And kind of what you want to do in dentistry, you need to pave your own path for it. So when you do finish dental school or even a residency, a lot of people go and work for corporate. So DSOs, dental service organizations like Aspen Dental, Pacific Dental. And not that they're bad, but you'll do a lot of volume there. And then there's those who do like high-end niche practices, which is, I would say, what I'm working towards. Not quite there yet, but definitely on my way. where they really only focus on implants or cosmetics or comprehensive dentistry, or they have patients coming in for referrals because they know that they're going to be able to change your life. So these are the kind of patients who aren't really driven by insurance, which is nice. And these are also the ones that can be a headache because you're going to become married to some of them, but they're also can be quite lucrative. They're bigger cases. Um, so I like to kind of equate this to there's a reason there's a McDonald's around every corner, and there's a reason there's 3-star Michelin restaurants in the US or even in the world. So there's something for everyone. You don't have to fall into one of these two. There's a lot in the middle. So that's kind of where I see the profession. So my big take home here is invest in yourself. If you don't want to be doing, 20, 30 patients a day and running around from chair to chair, you're going to have to increase your skill set. You're going to have to learn how to talk to patients. You're going to have to develop an eye for what you do, and you're going to have to be a likable person. So kind of what I was talking about earlier with majoring in something, like learn how to talk to people, do communications, do psychology. You're not just going to be sitting in a science textbook for the rest of your life. Like that's very, very little of what I do every day. Oh, and lastly, Instagram. I definitely credit Instagram for a large portion of what I'm doing right now, and also how I've met up with and connected with a lot of people from all over the world. And I've learned a lot on Instagram. I've also met people through Instagram that I've taken continuing education courses from. And you can learn a lot just by kind of doing a deep dive into someone's profile. So when I first started, I had 10 followers. It was all my family and friends, and I'm growing a little bit with it, but I would message people all the time and ask them questions. And it's kind of nice that that has almost come full circle now. The same has been happening with me. People are messaging me, but I'm still this very amateur, in my opinion, dentist who needs to or who wants to get much better. So I'm big into self-assessment. That's where my camera comes into play. After I do a case, I'll sit down and study it and think about what I could have done better. So private practice. Um, like I said, I was in New Jersey for dental school. Then I went down to DC and I came back up to New Jersey and worked for 2 years. Um, I was in some of these practices that, oh, I'm sorry. I was in some of these practices that we saw a lot of patients, and I knew right away this wasn't what I wanted to do. But in the beginning, New Jersey, is a saturated state with dentists. There's a dental school right there in New Jersey. There's one in Philly or two in Philly, and there's a few in New York City. So there's a lot in a big radius, or in a small radius, I should say. So there's a ton of competition. Nights, Saturdays, weekends, I worked them all. And I said, something's got to change. I need to do something. So 2 years, I still learned a lot, but it wasn't where I saw myself kind of going. So an opportunity through the AACD opened up in Ohio, which was kind of like a residency program, like a pilot residency program for 1 to 2 years. And I took it and I learned a great deal in that residency program. And I'm very grateful to my boss at the time, because I like to say that we came for me to Ohio and we stayed for her, because she hooked her up with a specialist in the area who she still works with part-time, and she loves it and they love her. So we kind of decided how to make a decision in the midst of the pandemic, whether we were going to stay or go. And we decided on staying, and we've really grown to love Cincinnati. So that's where I practice now, in Cincinnati, Ohio. So ownership. After working here for about 3.5 years, the opportunity came to purchase a practice. So we did that almost a year ago now. I can't believe it's been almost a year. And it was a very established dentist who worked, I think, for about 40 years. So her patients really trusted that she would find the right people. And we met her through my wife's boss, who introduced us actually. So my wife and I both bought this practice together. She works with me part-time. And the old dentist just did restorative dentistry, and we kind of have brought a little into it. Some implants, some soft tissue grafting, and this is mostly what my wife does. Clear aligners, so Invisalign, which I had been pretty familiar with and did a lot of those cases, and some basic oral surgery. Part of those let me backtrack a little bit. Part of those 500 hours that I did to get that fellowship in the AGD were implant related. So 300 of those 500, I took a very intensive implant course. So I used to do a lot of implant surgeries, and I kind of decided it wasn't for me because you almost had to be all in or all out. And I couldn't get all in with it because the other part of the practice that is kind of the bread and butter and foundation of it didn't allow me to go all in with it. So I stopped doing surgery entirely. I'd say maybe 1 or 2 teeth I pull a year, extract a year. So I don't do any surgery anymore. I do only restorative, some Invisalign, and some dentures. So that is essentially what I do. I haven't done a root canal in over 4 years and hope to never have to do one ever again. And in our practice, our specialists, even though we do some of these extra procedures, they still receive 90+% of our non-restorative cases. So, we cherry pick what we want to do between me and my wife. So the quote on the bottom is, in dentistry, especially, if you're the jack of all trades, you're the master of none. So I wanted to be, or at least try to become as close to a master as I could. And that's why I've chosen restorative dentistry. So when I was first started working in New Jersey, I was working nights, weekends, you name it. Ohio is a little more chill, which is great. So we only work 4 days a week, Monday through Thursday. We have 2 full-time hygienists. We don't stack them and see a million patients. We see 1 patient per hour in hygiene. So I do 2 checks typically per hour and then have my own schedule. I have 1 clinical assistant. We have 2 front desk, and we have another assistant who comes in when my wife works part-times, which is typically Mondays. And in my schedule, I see anywhere from 2 patients a day to 8 patients a day, and 8 would be like a pretty heavy day. That does not include hygiene. My ideal day would probably be to see 1 patient, maybe 2 in the morning, and then just a few in the afternoon to do, little things. But I prefer to do more in my visits than just like a little filling here or a little something there. So that's kind of the way that I like to block out my day. And you can get a lot more done, and we can spend time with the patient. We can develop relationships with them, and that's kind of how we structured. That's kind of the practice we were looking to buy, and how we've continued to have it. I know my patients. I don't just see a name on the schedule. I know who they are. I know their kids, their family, kind of like how a hygienist would. But I would say I make that a big goal of mine to really know my patients as well. And I think they appreciate that because that's where the trust comes. That's where the loyalty to me comes. And patient wants to know his doctor. And that's kind of the case with the way that I wanted to set up shop and keep it the way we bought it from. So let's talk about a couple cases. I think we're doing pretty okay on time here because this is a shadowing thing after all. Like I said, I do a lot of restorative dentistry. So I do a lot of fillings. I like to call them restorations, however. And I do a lot of crowns or porcelain restorations, and I do a lot of aesthetic cases. And that's kind of a typical day for me. So I'm going to kind of show you one of each of these types of cases that are very typical for me in a day. So we'll give you a quick little background on X-ray reading 101 here. What you see here are teeth in the upper right-hand quadrant. The big one on the left there is the molar, and then the 2 to its right are the premolars. And in the molar and the premolar, you can see that white stuff, that's an amalgam filling, so like a silver filling. And that shows up very dense on the X-ray because it's radio dense. Whereas if you see black on the X-ray, that's where there's space. So you can see the black around the teeth, and you can see in that middle tooth black, and that's a huge cavity. So what we've been taught in dental school is probably most of our professors would see that cavity and say, oh, that's going to need a root canal. Send them to the endodontist, get a root canal, and do a build up and a post and a crown and all this stuff. But the way I've kind of honed my training in the last few years is we're better with the sciences, we're better with the materials. And if we take the time and do it right the first time and believe in the science and kind of trust the science and trust the tooth that it's going to heal itself, there's a chance the tooth will heal itself. And we don't need to do all of that unnecessary treatment, because a lot of times that unnecessary treatment, and not that it's wrong, but sometimes I think we're trending towards it could be a little aggressive. That treatment is going to end up with an implant in the future, almost guaranteed. Whereas I'm going to keep more tooth structure here, we are probably not going to be ending up with an implant as fast as we would be if we had gone straight to doing a crown, which is what all of your dental school professors will tell you you're going to need on this tooth after the root canal. So I use photography a lot throughout my cases. I take a lot of steps, photos of each of the steps. And after I've finished with the case, I sit down with the patient in our consultation room, and I'll usually show them what we did and why we do things a little differently. And this builds value for the patients, and it's another way for the patient to trust us. So this is kind of a maybe a little more than typical what I would take for a patient, but I'll kind of run through them individually now with you. So the first one I'll always take is what the tooth looked like starting out. And there you can see those silver fillings in the tooth. And the blue stuff on the tooth is where they're biting. And that kind of gives me a roadmap of where I know I need to build the tooth back to. And on this tooth, we're doing a direct composite restoration. So we're essentially doing, in layman's terms, a filling, but it's much more than a filling to me. Then I'll usually take a photo next here with the tooth isolated. So the blue thing in the background is called a rubber dam, and it is completely a non-negotiable for me. I use it for every single restoration I place. Every time I'm bonding something to a tooth, it needs to be there because it is going to prevent saliva, blood, contamination. It's safe for the patient. It's clean, prevents aerosols. There's a million reasons to use it. And a lot of people don't use it because it's hard to use. I'm not going to lie. It's a steep learning curve with it. I absolutely hated it in dental school, and now I can't live without it. And somewhere along the lines, I think I realized the best dentists out there are using it, and I should probably start doing that if I want to be one of the best. So this next picture I'll take is of the decay. So that's the decay. That's all mush in there. And then the one on the left now is once the tooth has been cleaned. So there's no more decay. I have avoided the nerve of the tooth. I've obviously consented the patient and told him what I'm going to do prior to starting. So he knew that there was a chance of a root canal, but the tooth kind of tested vital. So the tooth, that means I put cold on it and he can feel the cold. So the tooth is still alive. And then what I'll do is I will start restoring it. So I'll kind of band it up. So this is what I called matrix banding, matrixing. And I'll start that process, and I'll do it very slowly and in lots of layers because we don't want it to stress out the bond that we're trying to form on the tooth. And we'll continue building it up until we have a restoration on the tooth that looked like the tooth when he walked in. And it's going to function like the tooth. He doesn't have any more symptoms. He came in with symptoms on this tooth. It was very sensitive to cold and hot and temperature and sweets, and he kind of avoided anything real hot, real cold with the tooth. So we've restored his tooth back to normal. So this would be like a single tooth, and we could have also taken out the silver fillings, which a lot of people do when they're real small like this. Sometimes there's no reason, but I just wanted to address this single tooth. in this session with the patient. A lot of times I'm not just doing one tooth, I'm actually doing like a whole entire quadrant of restorative. So I'll do 2, 3, 4 teeth at once. And that way it's easier for me to do. It's a longer appointment for the patient, but they don't have to come back a million times. They don't have to get numb a million times. We can kind of do it all in one shot. They're comfortable with the rubber dam in place. Most of the time they're sleeping. So it's a win-win for everyone. So I jumped ahead a little bit of myself there. This is the x-ray, the final x-ray of the nicely adapted restoration that I placed in the tooth. And you can kind of see. Hello? Unmute this person. Okay. So that is the final x-ray. So like I was saying, a lot of times I'm doing more than one tooth. So this would be another kind of section of the mouth where we have a fresh cavity on the molar and the premolars there. It looks like there was older fillings with decay under them. So I would kind of go through here and do the same types of steps that I do with every single patient. I don't take every photo like this every time. This is more for education and documentation purposes, but the patients always know what I did. There's transparency with everything I do. You can see these little wooden things. I don't know if you can see my cursor, but the wooden things in the third photo are called wedges. They kind of help to establish a contact with the tooth. And then the next photo with all the pink stuff is a dye. It's called caries detecting dye. And I use it every single time I excavate decay to ensure that I have removed the decay that I want to remove and that I have a clean zone around it with which I can bond to predictably. And then the next photo is going to be of the clean cavity preparations. And then kind of moving through on the bottom left now, I've got my matrix bands in place, and that's going to give me the contour of the tooth. So the way I like to explain it is I essentially make a wall. I build that wall of the tooth, and then I can just fill a hole. So we build those walls, and you can see now they're kind of built, and then I just fill holes and we trim it, finish it, polish, and send the patient on their way. So that's kind of how I would do. And here's a little more zoomed in for you if you want to see closely. This is kind of how I would do like a direct restoration. So these would be fillings to the average layperson. They would be restorations for me. Case number 2, direct composite space closure. So a lot of what I do is in the posterior, and to be completely frank, I prefer the posterior to the anterior sometimes because the patients aren't as demanding, but I really enjoy doing cosmetic work. So a lot of my Instagram, I put a lot of cosmetic kind of before and afters on. So this was a direct composite space closure. So basically the patient came in and presented with a space between her teeth. She is an actor and she's on TV a lot and she does not like the gap. And what is that? That is called a diastema in dental terms. And I told her that her teeth are not too wide, that if we did close the gap, we could make them still look very natural. So we isolated with the rubber dam. And what I do next here is I put what's called a floss tie on it. And this just kind of pushes the rubber dam up to help retract the gum a little bit. So I ensure that I get a nice seamless margin from where I'm going to add the composite to the tooth itself, and to ensure that it's going to be hidden underneath the gum. And then I'll do it to the other side, and you can see how much more of the tooth is exposed. And right there in the middle is where the gum, we call that the papilla, has been pushed up and out of the way. So it's called retracted. In this photo here, where they're kind of overlaid on top of one another, you can see where the original gum was, and with the rubber dam in place, it almost pushes it up about 2, maybe 2.5 millimeters. So it gives me space to work with. I don't have to deal with bleeding gums or saliva coming out of the gums or anything. So It's just a really nice method for me to work, and it's comfortable for the patient. And then I'll etch the tooth. So this blue stuff is etch, and it creates like micro little porosities within the enamel of the tooth. So the bonding glue, I guess we can call it, will stick to the tooth better. And then we can add our filling material. And then it becomes very kind of chalky white and opaque once we do the etchant. And then we start using these little nifty matrix bands to kind of form the contour of the new contour of the tooth. And I'll do one at a time, and I'll trim it, and then I'll do the next one. And that's kind of what it looks like before we do the final polishing. And you can see the rubber dam is pushing the gum way up. So when I release that rubber dam, the gum is going to fill into the space. And I kind of know from biology and where that contact needs to start. So you don't have like a little space in between. So it looks natural. And that's what it looks like after we finish. That's probably a week or two later. We took a final photo. So we got a very nice result from this one. She was absolutely ecstatic, and she's smiling on the camera all the time now. And there's her smile. So that's the second case. And the composite blends very naturally. You can't even tell that anything was done. Third case is smile design. So a lot of these comprehensive type cases are long. I said you can almost become married to the patient, and that's because they take a long time. They take a while to work up. I probably take 100 photos of the patient from when we start to when we end, and everything in between. And they're costly. They're, you know, 10 to 40, $50,000 a case. So this is the patient. She presented not liking her smile, never really been able to smile. This was probably the biggest smile I could get her to do. So our initial records, kind of if a new patient comes into our practice now, we take pictures and we go over the pictures and what we see. That way they can see what we're seeing. So it's a great tool to use so they know what you're seeing. And then we'll take a smile photo here, and then we'll pull the lips and the cheeks out of the way. And this is called the retracted photo. So they can see what the teeth look like. And sometimes you don't have to do anything. You can show them this picture and they'll tell you what they want to fix. So photography is a super, super helpful tool to sell. And I don't like to use the word sell, but to sell aesthetic treatment and to sell dentistry. So we take them from the sides. We take them when their teeth are together, closed. I take about 8 to 10 photos on every patient who kind of walks through the door like this with my camera, one of my cameras. And then we'll take these photos. This is a very old case. So my photos are very scratched, or my mirrors, I'm sorry. These are taken with mirrors. So all those black lines on them are scratches in my mirrors. So we can kind of show them the state of their dentition, the state of their mouth with these photos. So we'll kind of go through what the problems are and kind of what we're going to do to restore this case for her. So there's crowding. You can see that very clearly here with these occlusal photos. The teeth are overlapped against each other, and there's not enough room for them. So a lot of crowding. Uneven gingival zeniths. In other words, the gums are not aligned. So kind of what we want is we want that central middle tooth to be in the same line horizontally as the canine tooth. So the fang tooth, the eye tooth. And you can see with her, it is not at all. Deficient buccal corridor on the right side. So basically what this means is if someone smiles real big and they show a lot of black, let's say over here, and they show all teeth over here, there's an asymmetry. So we want to kind of get it so it's either both teeth or both a little black. So this is what it means here. So basically what we want to do here is we want to broaden her out laterally on the right side. So we want those teeth to fill a little more of that space so it doesn't look like there's a shadow back there. And then some more problems, color, shape. We've got some older fillings, bondings in there. what I've circled here is the attrition, the recession, the abfraction. So these are a lot of just dental terms that you'll get to learn once you go to dental school, but they're multifactorial and there's not one reason any of them happen. It's more the etiology happens for a lot of different reasons, but the big one down here is the roller coastal occlusal plane. So this patient kind of doesn't have a home. When she bites down her teeth together, they don't really know where they're supposed to end up, and that's why she has a lot of wear on the teeth. So a lot of that is just frictional wear. She's not a grinder. She just doesn't really have a home when someone tells her to bite her teeth together. Sometimes she could be closing in one way, sometimes she could be closing a different way. So we kind of have to restore her back to having that dental home. And then on the lower molars, we've got some larger failing composite white fillings and amalgams. So what are we going to do on this patient? Well, we're going to first do some Invisalign, and then we're going to do restorative dentistry. And her kind of chief concern was, I want to be able to smile again. So obviously this is going to be a bigger case. It's going to require a lot of dentistry. It's going to require aesthetics. And the more you can get the teeth in alignment to begin with, the less you have to prep them. So, but what I mean by prep is you can't just slab porcelain on top of someone's teeth necessarily, unless there's some spacing or there's small teeth to begin with. So you need to remove a little tooth structure in order to add it back. And if we didn't do Invisalign, we would end up prepping so much of her teeth that we would probably end up with root canals on a lot of them. So Invisalign first. You can see on the left is where her teeth began, and that looks very much like our photo that we took. And on the right is our proposal to see where our teeth are going to end. And so this Invisalign, it looks like I got to speed up a little bit here, was 70 weeks worth. So about 15 months or so. And we got her teeth looking much, much better. We've somewhat aligned the gums now. We've brought some teeth down. We've put them in the arch. We've expanded that buccal corridor we talked about. So already she's been smiling. She likes her teeth much more, even though they can use a little work with the shape and the color. So Invisalign is a very valuable tool for me to do before I put a burr to a tooth, before I prep a tooth. So you can see from the occlusal photos here, we've also aligned things very nicely. So the next thing we have to do is we have to communicate with my lab. So this is where I get on the phone with Peter. I take all these photos again, I send them to him, and we sit down and we talk about the case. We discuss it. Now we do it over the phone. I used to go to his lab when I was in New Jersey, but now we stick all the photos in Dropbox and we get it on the phone and we talk about it. And the lab makes what's called a blueprint. And this is what I tell the patients we need to do. We need to do a blueprint because you wouldn't build a house without a blueprint, just like you wouldn't build a new smile without a blueprint. So the blueprint is essentially a wax up. And our lab tech, Jennifer, puts wax on the teeth so we know what the size and the shape in the new teeth are going to look like in relation to the mouth. And we also do a wax up on the lower teeth. And we're going to keep the lower teeth pretty much how they are, with the exception of the back teeth that we're going to fix. So the back teeth, if you look at the top photo, this is before Invisalign, but still we didn't have a home. And that's because she's slid around on her teeth so much and kind of friction has ground them down that she doesn't have any of the natural contours anymore of the tooth. So the teeth don't fit in together with the top teeth. So if we're going to do the top teeth, we need somewhere for them to fit into, which is why we have to do some of the bottom teeth as well. So on the bottom, we have kind of built them back up to where they're supposed to be, so we can use that as a reference to build the top teeth. And then comes a day for preparation. So these are the crown preparations. They're full coverage crowns, so they're about as conservative as you can be. And we had to do crowns because we had some old dentistry in between them. And then we temporize. So these we call temporaries or provisionals, or as I like to say, they're the prototypes. So this is based off of the wax up, the blueprint that we had. And this is kind of going to give the patient an idea of what the final tooth form is going to look like. And this is where we can hone in on things and say, do you like this part? Do you not like this part? And we're only going to go to final when we have the patient agree on what the prototypes look like. So she liked everything she saw. We have a little bit of a it looks like here to correct, which is essentially that the teeth are a little crooked in the face. And then it goes back to Peter and he does the beautiful porcelain lab work for it. And then we put them in. These are the preps. So this is after I removed all the temporaries, and you can see the gums are pretty much in pristine condition. There's no bleeding on them. There's no redness, inflammation. So this is a very easy seat for us. We can put these in fairly easily without having to worry about a lot of things that could become problematic. And then we changed out the lower fillings to porcelain. And this is a lot of the type of work that I do on a daily basis as well. I'm not really cutting down a lot of teeth for full coverage crowns per se. I'm trying to spare as much of the tooth as possible. So we like to call that being minimally invasive. That way, if the tooth ever does need work again, we have a lot more tooth structure to work with the second go around. So that's what we do here. We bond these in. These are porcelain. And these are the finals on the uppers. They came out very, very nice. She was ecstatic, loved them. And on the bottoms, we still have those kind of the provisionals on. And this is before I was able to take a final photo. And there she is, shows she's a different person. All right, advice for pre-dents. We're almost finished here. So grades matter. I wouldn't have gotten into dental school. I didn't get into medical school with my 3.1 GPA. You're not going to probably either, which is why some of the schools now have post-bac programs like Rutgers does, UConn does, or Tufts does, I think. So if you're still a first or second year in undergrad, make sure you study and get those grades to where they need to be, because they are objective, and that's one thing that they can do to weed people out. Don't get bogged down reading forums, Reddit, Student Doctor Network, if that still exists. People who go on there and post all their stuff and worry about things are usually the ones who have no reason to worry to begin with. They're probably just looking for, an ego stroke or something. So don't get bogged down with them. Just do your own thing, be yourself. Your objective scores will get your application looked at, but they will also get it thrown to the side. So you want to be competitive with the DAT, you want to be competitive with your grades. After that, it's kind of what you choose to do to make yourself stand out. Like I kind of already alluded to, maybe don't be the 500th biology major that they look at. Maybe have something else. Sports, extracurriculars, volunteering, letters of recommendation. There's a lot that you can do. I'm sure you all are doing this. During the interview, be yourself during the interview. Have experience shadowing. Know what dentistry is. Know why you want to become a dentist. And more importantly, make sure you want to become a dentist. I can't tell you how many students that I graduated with didn't like dentistry, hated dental school, hated dentistry, hated doing it, and they just couldn't wait to go into practice. Well, let me tell you, practice is much harder compared to dental school. So there's a lot more challenges that you're going to run into. You don't have to study anymore, but you need to want to do it, or else you're not going to have fun. All schools are essentially the same. Choose in-state or the least expensive. You're going to know this when you start paying down your loans and seeing what your loans are. You're going to see this when you interview with people for residency. You're going to see some people who went to Ivy League dental schools. They're not Ivy League dental schools. A dental school is a dental school for the most part. It's just going to be whether you have to graduate doing 5 crowns or 20 crowns. So you probably want to do the ones that you're going to do the most in. And fortunately for me, Rutgers was a good school for that. However, I will say all dental schools are very behind the 8 ball in teaching kind of modern adhesive dentistry. And that's because a lot of the professors are older and very traditional with their methods. And I think finally the profession is trying to trend in the right direction. Like I said earlier, it's what you do after school that really determines the trajectory of your career. Loans and interest add up. Dentistry is not as lucrative as you might think. My first year, I probably made less than a hygienist does at any practice in America. So you're not going to make all that money that you think you're going to make right out of school, probably unless you choose corporate and get that signing bonus. But that being said, you're probably not going to be too happy because I think most people I know who went into that only lasted about a year or two. You must have a strong desire to do it. If not, you will be very unhappy. And that is it. I will leave it back to you guys to see if there are any questions that I might be able to answer.
Okay, thank you so much, doctor. That was a wonderful presentation. If you guys have any questions, you can just leave them in the chat and um, we'll answer them. I think I can get us started. I have a couple of questions that I wrote down. So my first question is, do you have any tips for someone that wants to start their own practice?
I miss that. Someone who wants to what?
Start their own practice.
Start their own practice?
Yeah.
Yes. I I kind of think you need to know what kind of dentist you want to be before you start your own practice. So, and the only way you're going to know what kind of dentist you want to be is by doing it and seeing what works for you and what doesn't work for you and what kind of pace you want to have, what kind of patients you want to see. And then once you know what kind of dentistry you're going to want to do, and some people seeing 20 patients a day is what they want to do. I had friends who saw like very high-end aesthetic, comprehensive dentistry lectures, and they'd look at me and they say, I would never want to do that. And then for me, that's like what I want to do. So everyone's going to be different. So you kind of have to know yourself before you decide what type of practice you want to open up. And once you do know yourself, I would probably still recommend working at a few different practices. So you, as an associate, so you can see what you do like about that practice, what you don't like, and kind of take the good with the bad and make it your own.
Yeah, awesome. Okay, we're not getting anything right now, but I have a few other questions. Do you have a moment that was your proudest moment where you thought, like, this is why I do what I do?
Yeah, I kind of feel like it's almost every day.
Yeah.
When I'm like sitting and just relaxing, doing my thing or sculpting a composite or something, I consider it's like a hobby to me. It's fun to look back on my older work and see what I was doing then and see how much improvement I've, done since then. And uh, especially like cosmetic cases, even um, the ones who say I should have done this much sooner. You've changed my life. It's every day for me.
Imagine. Okay, we do have one question. Would you recommend going to dental school right away after undergrad or taking a year or two to gain more experience?
That's a good question. I had a lot of friends who were 7 years. They did 3 years undergrad and then dental school, or a lot who came straight from undergrad. I had 5 years between. I had some who had, I had a friend who had like 11, maybe 10, 11. And I'd say it's going to be different for everyone. But what was really nice for me to have a little extra time was I was able to live my 20s a little differently than most people would if they're studying all the time. And so I had a lot more life experiences that I didn't feel like the need to go and catch up with those types of things after I finished dental school, almost like keeping up with the Joneses type thing, probably. But that being said, if I had known earlier if I wanted to do dentistry, I think I wouldn't have hesitated to go into it a little more quickly. I just didn't know that I wanted to do it until, 3 years out. So it can go either way. It kind of depends.
While we wait for some more questions, I do have another one. So how did you balance school and just like free time in dental school?
So I kind of always knew I didn't want to specialize. So grades, even though they were important to me, they weren't, I didn't need to get an A on everything. And the way dental school works, I like to tell people it's like just getting flooded with trying to drink out of a fire hydrant. I think a lot of people say there's just a lot of information, a lot of volume. And for the most part, classes and I'll just say I graduated in the top third of my class overall, and clinically I was one of the top few. So it doesn't really matter where you finish, but I didn't want to get like poor grades. We weren't pass fail, but I wasn't content getting C's and things. But I also, if I had to study 20 hours for a test to get an A and only 8 hours to get a B, guess what? I was going to get the B every time because those 12 hours just to get one or two extra questions correct is the answer to your question. Like I wanted to have a life during dental school as well. And I did, and I don't really regret anything that I did in dental school. I actually had a great time doing it. And I think probably more people looking back would probably say that they wish they had more of a mentality that I may have had, where they probably didn't waste as much time studying for things that they'll never use again, and maybe seeing their friends and family a little more and going out and doing enriching activities.
Awesome. Um, how many dental schools would you recommend applying to?
I would recommend applying to as many as fit in your budget. You never know what people are going to be looking for on the committee. Um, or who's in charge of reading applications. Something may stand out to some school, and had you not given that school a chance, you may not, you may walk away not getting in. I have a good friend who I was telling you earlier, 5 times he applied to dental school, and it was on the fifth time that he got in. Well, he was our class president. He was Mr. Student Doctor of our school, and everyone loved him. And sometimes if you don't apply to more schools, you may not have that one person who sees something in your application that probably everyone would have seen. So as many as fit into your budget, but I would absolutely recommend applying to your state school and the ones that are least expensive, because it's what you do after school that really matters. You're gonna be paying another 2 years of dental school and continuing education. So the only thing is you're not really going to be able to get a loan for it. So you're gonna have to pay it on your own.
And another question says, what would be your tips for getting your name out there after graduating?
Getting your name out there in what regard? Like
They
to
didn't
to find a
say.
job?
They didn't specify.
Okay.
Maybe, yeah, maybe getting a job or like getting patients.
So you're always going to be, oh, to get patients, I see. Well, a lot of times you're not going to be starting up a uh after graduating. Yeah, you're not going to be starting up a practice from like hanging a shingle, as people like to say. You're going to be walking into someone else's practice, but it's very organic the way it works. Like a lot of patients come to me because they hear of me through someone, and it's word of mouth, internal referrals. Um, to get patients, I think just being true to yourself and being true to your dentistry and just having transparency and doing the right thing is what's going to get you patients and keep you patients. And eventually doing the right thing is what's going to make you money too.
Awesome. I have another question. What
Okay.
do you see as the future in dentistry? So like any new technology or any new things like that?
Yeah, I think the biggest buzzword right now, obviously a lot of people know that digital is here to stay and most practices are very digitally based, but I think the big thing right now is AI, artificial intelligence. We have a lot of um, programs that are looking at x-rays and actually reading the x-rays and looking at cavities and looking at gum disease and bone levels and things like that. So I think AI is going to be kind of on the upward trend in the next few years. As far
Yeah.
as dentistry itself goes, I almost see like a schism right now in where we are, and I kind of see that getting bigger. And a lot of that has to do with insurance. Like we dentists don't really like insurance reimbursement rates and what insurance does because it gets in the way between us and our patients. And the people who are taking insurance like head on are those corporate entities because they can do volume, kind of like the, McDonald's. And then in order to separate yourself from the masses, you're gonna have to do something different. So that's where those niche like practices come in, where you can do, I think, more rewarding dentistry.
Thank you.
Yep. And one more thing I just thought of actually that I forgot to mention, when you guys are interviewing at Rutgers, I was on the interview committee with a bunch of other students where we gave tours and talked to the candidates before they actually went in for their interview. And I'll just tell you, you start your interview the day you arrive. So what you look like when you walk in, what you're dressed like, how you present yourself. You want to be social. You don't want to sit there in the corner and not talk to anyone. Like we're judging you from the moment you walk in. So your interview is not just with the faculty or the professors or the dean of the school, whoever is going to interview you. Your interview is with all of the students that you meet. It's going to be with all the people that you meet on your tour, saying hi to the people who are, maybe changing the garbage cans, things like that. And that's going to be the case also in private practice. And what's going to make you successful as a business owner, as well as like a clinician, you need to treat everyone with complete equal respect. Like you're not above anyone else just because you're a dentist. I like to say that we work with, our team members. They don't work for us.
Yeah, I think that's awesome. Anyone else have any other questions? I'm not sure, you might get some questions messaged like privately to you. I don't know if there's like a way to check that, but
Yeah, I don't see anything, but if you guys ever want, I post a lot on my Instagram. You can always reach out to me on there with like a DM or a comment on a post or a story or something, and I answer everyone that's not spam. So you're always welcome to ask questions in that regard.
okay. If there aren't any more questions, we could wrap this up. I'll give everyone maybe like a couple more seconds to see if there's any other questions. Okay, I think we can wrap it up. Thank you so much for your time. This is really informative.
No problem. Thanks for having me,
This
and
video is
good luck to you all. Yep.
sorry to cut you off. This video is going to get posted to YouTube, so you guys can check it out. There's also going to be a post attendance quiz that you guys could fill out. All of that is going to be linked in our bio on Instagram. Also, make sure to check out the doctor's Instagram page. And I think that's it. So thank you guys again for joining. Thank you, doctor, again for joining. And I will conclude this meeting here.
Thank you.
Thank you.